New Jersey's children face critical threats in 2025, impacting their health.
With cuts to Medicaid on the federal chopping block, local advocates are speaking up, urging Congress to protect funding and access.
Of those 1.8 million people enrolled in New Jersey family care, there are over 830,000 children. 90% or more of the children and youth living in foster care in New Jersey are on Medicaid.
We collected over 2,400 signatures to share with New Jersey's congressional delegation. We called for action when New Jersey froze its child care assistance program for new applicants.
As of August 1st, New Jersey's child care assistance program has slammed the brakes on new applications. Advocates warn that these changes could hit businesses just as hard.
There is a workforce shortage. This is only going to make it harder. Families are really going to now have to decide between working or staying home.
From the nation's capital to town hall meetings to childcare site visits with New Jersey's congressional delegation, we made sure children's needs stayed front and center in every policy decision, reaching more than 29,000 through NJ Votes for Kids, educating candidates on key issues.
When I talk about the affordability issue all across New Jersey, you know one thing I never mentioned? Childcare. It's not because I don't know that it's not terribly expensive, but we need to put this at the top of the list.
If you can't afford to have childcare, you often can't afford to work. You often can't afford to feed your family. And I can speak for Mike and say, this is going to be one of our main priorities.
Engaging the public through ACNJ's monthly Lunch and Learns.
And hello and welcome to another ACNJ Lunch and Learn.
About the urgency and the importance of supporting the care workforce.
Understanding the state budget.
Using data to understand the health of families in New Jersey.
To talk about what social, emotional, and character development is.
Leveraging literacy as a New Jersey imperative.
Reproductive justice as the foundation of this conversation.
What are some of the major reasons for chronic absences?
In response to a growing number of individuals calling ACNJ for help for an individual child, ACNJ opened up a Children's Legal Resource Center in 1993.
In 2025, our education caseload will exceed 400. ACNJ continues to advocate for a stronger public preschool system, enabling New Jersey's 304 participating districts to partner more effectively with local childcare centers. Organizing New Jersey's first ever community-based private provider conference.
For the first time, community-based private providers from across the state are gathered together to talk, to learn about the future of public preschool.
Centers are struggling again. They're struggling to retain their workforce. They're struggling to retain qualified teachers. There needs to be sustainable funding, and it needs to be a priority because we know workforce is an issue in the state for all industries.
We made sure policymakers heard their stories. Thank you to the parents, childcare providers, and young people who shared their struggles and solutions.
We know that stories can be both informative and deeply moving and help policymakers and community providers truly understand what is working for families and what challenges still need to be addressed.
Gathering stories from across the state.
Hi, my name is Kenny.
My name is Trey Shawn, and I'm from Somerset County, New Jersey.
Essex County.
I'm from Atlantic
Burlington County.
Union County.
Together, our voices were too powerful to ignore, and the state reopened CCAP in December.
I have missed this opportunity to stand in solidarity with an issue that, quite frankly, has been a cornerstone of my policy agenda since before I got elected. The growth that you see in those early years has been extraordinary. There is evidence-based science that is just not unique to New Jersey. You will probably hear that from our partners at ACNJ.
There is much more work ahead, but with your support, we're ready. From our Parent Leadership Council to our network of donors, funders, and advocates, you make this possible. Join us as we embark on a new partnership, Start Strong New Jersey.
We cannot create a system where preschoolers are supported while infants and toddlers, the most underfunded yet critical group for brain development, remains left behind. And without big, sustained investments, we cannot continue to patch a broken system instead of building one that works for families, providers, and businesses alike. We must treat childcare as essential infrastructure. And together, through Start Strong New Jersey, we will deliver a childcare system that is affordable for families, with a workforce that is professionally compensated, sustained by bold investment, and strong enough to power New Jersey's economy.